Mariah, welcome to the show.
Thanks for having me. I'm excited to chat.
I'm excited to have you on. Gotten to know you a little bit, and it's one of the things that there's a lot of things you're doing and what you do and an expertise in that I am a big passionate about. I think it's a huge thing, and it's starting to get awareness, which I'm very excited to. At least I'm hearing more and more people talk about this, and can't wait to pick your brain on all this. So before we get into that, though, tell me a little bit, and you can take this however you like. How'd you get into all this? How did you go, doing what you're doing, but then also specialize and have a niche into pelvic floor and so forth?
Yeah, so I get this question very often because it's a specialty to practice in. I started getting a hint that I wanted to do pelvic health actually in grad school. It was a topic that came up here and there, but never was dived into. Like, we never further discussed it in classes or anything like that. And for recognizing that it's such an important area of the body, it has so many functions, I was just always confused why there's so many more questions I have. Why aren't we talking about this? So once I got out of school and I started practicing in orthopedics, I immediately started taking more coursework. I wanted to know more. How can we address this area? And as you start to treat clients, you start to recognize, oh, it's not just a hip issue. There's something else going on. Oh, you also have incontinence. Oh, you're also struggling with this pain or whatnot. So actually in my orthopedic practice is when I started noticing we need to add in pelvic floor. This needs to be a combination treatment for a lot of people. So I worked to get my specialty certification in pelvic health. And, helping someone with their knee, helping someone with their shoulder, it's a rewarding career to have. But helping that person who's just whispering to you like, hey, I just want to be able to stand up in church without passing gas. Like, building a connection that's so intimate that people trust me enough to come to me with these issues is so, so rewarding. So I get to help people of all ages, whether you're male or female or transitioning. I can help you with a lot of different things: incontinence, pain, pregnancy, prep, infertility, postpartum issues. So I love that it's such a special, intimate connection with my patients and that I can help them with some of these more personal issues.
Yeah, I love that. It's one of those things where you brought it up, male or female or anything in between, because it's like, a lot of times when you first hear pelvic floor, it always goes to the female first, right? The ones who I can't laugh too. Like, I used to be like, they'd be like, Dr. Vic, don't make me laugh too hard because I'll pee in my pants. And I'm just like, I'm not that funny. And they're like, it's not about you being funny. And I'd be like, I gotcha. All right, we can work on that. There's some things we got to do. But it's also in the male world, I've seen it more and more too, coming up and being more common, also with a lot of variety of things. What are some of the things that, when it comes to like pelvic floor, what are some of the common things you see, or what's like a most common pressing issue that you'll see when it comes to like the pelvic floor itself?
So this one kind of shocks a lot of people. Probably the most common diagnosis I treat is incontinence of all different kinds. And most of the time when we hear incontinence, people initially think, well, my muscles down there must be weak if I'm leaking or I'm peeing my pants. It's actually the opposite. About 90% of the time, when I assess all the different muscles that attach to the pelvic floor, we actually find that they're holding extra tension in their pelvic floor muscles. So take, for example, if this is my pelvic floor and I'm holding extra tension, just that baseline at rest, and now I cough or I sneeze or I jump and these muscles have to contract more, there's no room for them to contract more. They can't withhold the pressure from the full bladder. And so then we're leaking. Or because you've been holding so much tension all day, now when there is that extra force of pressure, the muscles aren't strong enough. They're tired. So they kind of let go and we get leakage. So a lot of people are surprised when I tell them, you're not weak down here. We actually need to work on your mobility and your coordination. And they see improvements very quickly.
Yeah, that would make a lot of sense. Just from the neural side of what I see, it's very, we're very sympathetic dominant culture. It's being a ped doc. I see it. I had technology I use where we can see it with a newborn being already stuck in that state.
Mhm.
being born. Some people, like moms, will be like, I don't get it. They only been out for like a week or two. What's their stress? And I'd be like, it's not about that. I go, I can explain a lot, but I'm going to keep this short for you, of why this is happening in some way, shape, or form. But there's a whole plethora of stuff. But that doesn't, excuse me, that doesn't shock me too much on that end, because we're just more stressed as a society and so forth, and seeing it in that way. How about let's talk pregnancy a little bit, because I think that's, um, I'm happy to hear more people now. Or I mean, my environment where I come from, Chicago, I didn't so much hear about pelvic floor prep, during pregnancy or before to do that. I was aware of it, but I didn't. It was, again, just something that, like, I come to Knoxville and I'm like, wow, a lot of people are talking about that. I'm liking that, man.
Mhm.
There's a lot of people here that are bringing that up already. I'm like, they're a little bit like, all right, they're really big on pelvic floor. Why would a woman, let's just talk women first, why would they need to work on their pelvic floor? Um, I would say before pregnancy. I know you can work on it during. I'm just very like old school. Well, I don't want to say old school. Just, I'm very like, let's address these things before. What then? That way, if we need extra time, we have it. Where if you're pregnant and some people say, well, you can take care of it while you're pregnant. It's like, yeah, but what if it needs a little extra work and we're not getting there? There's only a time frame of how much we have before the event.
Mhm.
So, love to hear your thoughts on all that.
Absolutely. So I like to explain it to people like pregnancy is like a marathon of sprints, right? When you're going into labor, you're going to have contractions and they're going to get more intense and closer together, right? And so we want to train your body for that experience. You wouldn't just go run a marathon without any training. You wouldn't be able to move the next day. You would have nothing left in the tank. You probably wouldn't finish. We want to set you up for success during your pregnancy, for labor and delivery, as well as your postpartum journey, because you don't get breaks in between. You go right into the next one, right? Baby's there, they need you, and you're exhausted. You just went through a feat, and now you got to be ready to go. So we want to prep you in that way, but it's also, when we look at like musculoskeletal function, um, the body is super adaptable, but you just have to give it the right stimulus. One of the biggest misconceptions out there right now is, if you're pregnant, you should be doing a bunch of Kegels. This is not always appropriate for every person. And until you've been assessed, I wouldn't encourage you to just do a bunch of Kegels, because your body is going to learn these neuromotor patterns, right? And when we're trying to vaginally deliver a baby, we actually need the pelvic floor muscles to move out of the way. We need them to have the mobility to stretch to a level that they've never stretched before. And so we want to make sure that the mobility is there. Yes, we do want those muscles to be strong, and we can work on strength as well. But it's also a time component or a coordination component, especially when it comes to like stress incontinence when you're pregnant. That's usually more of a coordination of the muscles and the nervous system compared to just a strength issue. So there's a lot of different areas we can look at. Pregnancy is complex. Everything is changing all the time. And so as a pelvic floor therapist, it's awesome to join someone on that journey, because we can constantly be modifying what we're doing to make sure that we're optimizing that journey for them.
I love that. And I mean, it's one of those things too where, you brought that up, and it just kind of ties to something else that you were saying, like the whole incontinence thing, right? It's tight, it's this. And sometimes, at least in my experience, I've seen a lot where if mom has very tight pelvic floor muscles, it's just going to be a longer labor process, to where it's going to take longer time. And especially like you were saying, the whole stretch, they've never been stretched like this before. I mean, it totally relates to, like, I always, whenever I talk to new moms about to have a baby, I'm always like, this is going to be your longest labor process out of all of them. I can bet almost my whole career on it, just based on what I know. But I'm like, and it's funny too, because it does, I think it reduces, if it, without Cairo, if you just did normal, going to a hospital and having a birth, first time is like 15 and a half hours of active labor. Now this is, of course, I always have to be clear on this, because they changed the rules a little bit from when I was in practice before into transition. They changed it where it was like 4 centimeters was considered like active labor. And then they've shifted it now to 6 centimeters. And I'm like, that's changing goalposts. That changes all the research. So this research I'm sharing is actually 4 centimeters, not at 6. But second baby on is like 9.5 hours of active labor. And so just kind of tying that together of like how that all coordinates and works in that way. But if mom has tight pelvic floor, what are some things, and I know I brought up a couple, but what are some things that will show up in, let's say, pregnancy, and then, or maybe not much in the pregnancy, but in the labor process?
So let's start in pregnancy first. Something that a lot of people just aren't aware of is there's many muscle groups that connect into the pelvic floor. So I have my little model here to kind of show you. Here's your pelvic floor. Here's your pubic bone. Your abdominals are wrapping down and attaching right here on the pubic bone and into the pelvic floor. So think about when you're pregnant and your belly is expanding to its maximum plus some. That's like a tensioning force pulling up on the pelvic floor. From the bottom, we have your inside thigh muscles coming up and attaching right on this pubic rami, which again is a direct connection to the pelvic floor. When you're pregnant and your hips are trying to widen out to accommodate for the space that baby's taking up, that changes how our hips are positioned. They're a little more externally rotated. And so now we have increased tension on these adductors. So basically, everything is pulling on that pelvic floor, increasing that tension. Now, this is where pain can start getting referred to different areas. So I have a lot of people who come to see me and they're like, the pressure in my pelvic area is so unbearable. What do I do about it? And it's not just because baby is pushing down on their pelvic floor, but it's because it's getting tensioned in all these different other vectors. We can work on the abdominals. We can work on the adductors, all these different areas. So most people will have either pain in their pelvic floor, pain in their pubic symphysis. That pain may even refer back around to like the SI joint or the hips and glutes, even the back. So that's usually what we see in pregnancy. How that can contribute to some issues during labor and delivery is, again, we need that full mobility. We want to decrease your risk of tearing or the need for an episiotomy. So the more mobility or range of motion these muscles can move in is going to decrease your risk of those kind of issues. It'll also decrease your risk of hemorrhoids and anal fissures and all of that fun stuff too. And the other thing that can really contribute with some pelvic floor tension is actually constipation. Constipation is very common in pregnancy just to the increase in progesterone levels. But if you're holding extra tension in your pelvic floor, that also contributes to constipation. So we can help with that issue as well. And then, go ahead.
No, you go ahead.
Postpartum, just to finish out the whole journey here. Postpartum, especially if you deliver vaginally, these muscles have been through a traumatic experience. Think of if you had a shoulder surgery. Everything around your shoulder would kind of tense up and try to protect you. Your nervous system is in overdrive. You're healing. The pelvic floor does the same thing. So most people postpartum have this increased guarding or tone in their pelvic floor as well, which again can lead to all of the issues I just listed.
What about somebody? Let's look at somebody who has because I've talked to a lot of midwives in my career, and I know they say a lot of times it's extremely common to tear if you had a vaginal birth on your first one. But what does that look like for somebody who had tearing, or maybe even go through the grades of tearing? Because maybe that might be good for the listeners to hear. And then what does that look like? And I know this is hard to say, like, what's the rehab for all that? Because I know it's different for each grade tear and the person itself and what shows up in an assessment. But if we can kind of like generalize that in some way, that'd be great in some way, shape, or form.
Yeah. So first we'll talk about prevention, right? So prevention, even if it's your first birth, if you ever heard of like perineal massage, we instruct people in how to perform that correctly, whether it's performing it on themselves or having a partner assist them. And that can, again, prep those tissues for the upcoming task. And that will help decrease the risk of tearing and episiotomy. Postpartum, if you did have some tearing, there's still a lot of rehab we can do on that. Tissue heals from the inside out. So usually when the tearing is healing, a little bit of scar tissue will form, and that can increase your urinary frequency. That can cause pain with intercourse, those kind of things. And so we'll actually teach people, or we'll manually work on those tissues with some soft tissue mobilization to kind of get that scar tissue moving more freely again, so there isn't any limitations in that tissue. When it comes to levels of tearing, to keep it simple, there's 4 main levels of tearing. The first 2 affect more the muscles around the vaginal opening and then into the perineum. The second 2 levels actually go a little bit deeper and can affect the external anal sphincter and the internal anal sphincter tissues. And so, again, just because it's a greater degree of tearing, it can take a little bit longer for those tissues to heal. There can also be a little bit of nerve damage because there's a lot of very sensitive neural tissue down there, and nerve tissue doesn't like to stretch. And so some numbness, some tingling, those kind of sensations immediately postpartum are all normal. And I think that's the biggest thing, is to let people know that none of it is something to worry about. There's a lot of resources. There's a lot of people out there who are willing to help you. So your main goal immediately postpartum is to just rest and heal for the first couple of weeks. And then you contact someone you trust, and we'll take you the rest of the way.
Great. You answered my question, because I was going to be like, okay, when's the time for someone to start working on all these things after pregnancy and so forth?
On that note, a lot of people will say wait at least 6 weeks. That's usually when people have their follow-up with their OB. ACOG, which is the American College of Obstetrics and Gynecology, they actually don't even recommend 6 weeks. They recommend an individualized approach for every person. So I encourage people around week 2, week 3, just depending on how things are going, actually make your appointment to come in and see me, and let's get you started. We can work on a lot of different things that aren't going to cause you excess bleeding, cause you excess pain. And it actually gives you another set of eyes to watch over you in between that time before you go back for your 6-week checkup. So I would give it 2 solid weeks of just letting the body heal, focusing on rest. And then if you're ready, we'll jump right back into things around week 3.
Gotcha. And doesn't matter if it's their first, second, ninth, it's about the 2-week, 3 period?
It's all an individualized approach. So however the mom is feeling will determine a lot.
Gotcha. Very cool. And so we're talking about postpartum here. We're going through that whole journey. Is there a certain time frame? And we talked about the beginning aspect of before pregnancy or during pregnancy. Is there a certain time frame someone should start to have their pelvic floor assessed? Do you suggest before pregnancy to have that all assessed? Is it like, no, we're good during pregnancy? I didn't really ask that question. I just want to bring that in right now.
If you're thinking that far ahead, like you haven't even conceived yet, yeah, anyone can benefit from learning how to move their pelvic floor. Guys, anybody. So it could be beneficial to do a session beforehand just to learn what your pelvic floor is and how to make it function efficiently. And again, it's going to increase that proprioception, or your body's ability to know how to move these muscles. Once you're pregnant, I like to start people around the week 24 mark. They've made it through that first trimester. They're starting to feel like they have energy again. And so that's when I really like to jump into a regular routine all the way through birth.
I love that, because I know for me, even from a Webster perspective, if someone's pregnant, I don't even do Webster until about 24, 26 weeks, right at the end of trimester 2, just because of round ligament, really. I could do Webster the moment they're pregnant, but it's because of the round ligament. I can feel where the round ligament is, but that tension doesn't really develop, at least in my experience, has been to really get access to it really well. About 20, I can get around 22, but I'm like, no, 24, 26 is where I like to really hit that assessment, and that we can take it from there and do strict Webster and a little bit of some other neural stuff that's showing up and all the other fun jazz that we do. So absolutely. I like the 24 week that you mentioned. So cool. So we're talking about women here, but I want to give a little love to guys too, because I know I'm seeing at least there's um, a lot of things happening in men's world where pelvic floor is actually something that can help them in some way, shapes, or form. So you might share just like what are some signs for men to look out for if they have a pelvic floor? What shows up?
So we're more similar than we are different. There's only 2 different muscles in the female pelvic floor than there are in the male pelvic floor. Obviously, the genitals are different and the organs are different. But muscular-wise, we're very, very similar. For men, they could be experiencing incontinence as well. I often see people with like a post-void dribble. So they urinate and they feel like they're done, but they just keep dribbling and they can't control it. Guys also struggle with anal incontinence, constipation. I'll often see people, men after prostatectomy surgery. But then even with like genital pain, so testicular pain, chronic hip or groin pain, or often I'll see people who thought they had a hernia, but they've had an ultrasound done and they haven't had a hernia, but it's just like that, just above the groin pain. We'll work on that a lot. And it's sad in a way because I know often we talk about how women's health is discounted, and it is in certain circumstances, but I've seen men who have been to 6, 7 different providers and have just been passed along. And I get to see them. And I even had one guy who started tearing up, and he's like, just thank you for listening to me. He was having pain in his testicle after intercourse, and it was freaking him out. They wanted to have kids one day, and it's your genitals, so you're worried about it. He's constantly thinking about it. He's in a fight or flight response now. And he's like, you're the only one who actually like listened to me and didn't make me think I was crazy. And I'm like, oh my gosh, this is ridiculous. How can the healthcare system do that? So we can treat a lot of different things. Don't let anyone tell you it's just in your head. Get a second opinion.
No, it's so true. I mean, and I know like the incontinence where they have the post dribble or was it post leak, post dribble? I forget what's the word you used.
Post dribbling.
I knew there's a dribble in there. I know that's been something on the increase because I remember I'd hear men would share like, "Hey doc, I go like this," but then all of a sudden it's like, I think I'm done. I do all that I can to empty out, and then all of a sudden there's just like this little excess every single time, no matter what I do, and I'm just like, good to know. But also too, I know there's some, and correct me if I'm wrong, if I'm not mistaken, even with like erectile dysfunction, there sometimes can be a pelvic floor mechanism to it with that. Cause I mean, that's a huge thing on the rise also when it comes to, at least what I've seen for men, because a man will, they won't, it's like they'll open, if there's something like that going on, it's always, I always know they're going to say something like that. Cause like, doc, I got to tell you something. And then we're in a room that's closed in. You can't hear outside of it. And they'd be like, I have it. And I'm just like, oh, you mean this? And he's like, yeah, shh. I'm like, there ain't nobody here. You're fine. I got you. This is all under full disclosure. No one's going to know any of this. But it's always interesting that, in a lot of times, pelvic floor and other things come up and it's just like, oh, cool. It can be related to that. And again, helping with that can change the, like you said, the guy has pain after having intercourse. That can freak someone out drastically, and so forth. So, I want to make sure we gave some of the guys some love there. So it's not all about the women, although women need a lot. I don't want to say need, but it's just, there's a lot more there is. I mean, bearing children is a lot of stress. That's a lot of work. I mean, even for me, I always tell my wife, I go, my wife, when we had our firstborn, I looked and I said, honey, I love you. I've always respected you. I've always seen the world in you. After this experience, I need to figure out what words I want to use because it's like, I don't know how to explain it. Like, you have my respect tenfold beyond ever. And I will always, just because, and I've always been that person for women because, when it comes to pregnancy, how much fear is built into pregnancy, right? It's just, why are you disempowering women? It just annoys me. I don't like anyone that disempowers anybody. So, but if women get attacked so many ways. And so I was at a point where it's like, this is what has to happen. But then I see my wife go through what she goes, and I'm just like, yeah, now I'm at a whole nother level. It's
Mm-hmm.
just the amount of work stress, and women are more involved than men. So I mean, it's just let's be real here. I mean, neurologically, from a neurological standpoint, I tell this to men all the time. Like, hey, you can argue all you like. Neurologically, women are more evolved than men are. We don't have the same wiring than they do. That's why you can. Like I could spend 2 hours with my daughter and I'm looking for a 10-minute break. I love spending time with my daughter. But it's like one of those things where I'm like, if there's a lot going on, or let's say she's really being active, I'm sitting there going, this is a lot for me. My wife can do that for like 6-7 hours. She's like, I just need a 20-minute break and I'm refreshed and good to go in like 20 minutes. I need like an hour if I had that much time. So anyway, I'm digressing here a little bit, but it just kind of tying in with all that. Any other information that we talked about that you would love to share before we kind of wind things down a little bit that I may have missed? Or final thoughts?
The other thing I would like to mention is that, you know, a support system is really important because we talked about it. It's a complex journey through pregnancy and postpartum. So I love bringing in the partner to assist us in learning. Like there's different laboring positions available out there. You don't have to give birth on your back if you don't want to. There's a million tools out there you can use. Here's how you use them. Do you want your partner to be hands-on with you? They can provide some counter pressures and guide you this way because there's a lot going on in that delivery room. So to have someone else's mind and eyes seeing the situation, especially if you're not going to have a doula or a midwife present, can be super beneficial. So I love bringing them in for training, just for extra support. And just know that, you know, education is the best tool you can have. So seek out professional advice. There's so many podcasts, there's so many things out on Instagram and TikTok now. Be careful who you listen to, but seek it out. Don't just try to fake your way through it. There's a lot of us out there who are trying to help you out.
I love that. Great tip there. And so then how can people find you, follow you, and all that good stuff?
So my husband and I run Nomadic Physical Therapy out of Knoxville, Tennessee here. We're on Instagram, nomadic.physical.therapy. We have a website, a Facebook page. You can find us on all of those different platforms, and we'd be happy to chat with you.
Love it. And for all the listeners, I'll have all that wonderful information in the show notes for you to check out and follow and all that great stuff. Mariah, thanks for being on. This was a lot of fun.
Always a joy to talk to you.
Oh, my pleasure. I hope I know the listeners got a lot out of this. It was a wealth of information. I know it'll help empower them in some way, shape, or form. So appreciate the work you're doing and all that you do. Pelvic floor is very, very crucial. And like I said, it's finally, I feel like it's at least catching waves to the point where I'm like, great, needs to have that conversation. It needs to be discussed, and people need to have it evaluated, men and women. And I appreciate the work that you're doing and all that.
Absolutely. Thanks for having me.